Good morning, Dr. Phil here. Today we will be discussing the arterial supply of the brain. The contributions of the four major vessels of the brain is as follows. 1/3 is supplied by the two vertebral arteries and 2/3 are supplied by the two internal carotid arteries. The vertebral arteries give rise to the two posterior inferior cerebellar arteries. The two vertebral arteries forms the basilar artery, which branches into the two anterior inferior cerebellar arteries, two superior cerebellar arteries, and two posterior cerebral arteries, which supplies the medial side of the temporal lobe and the occipital lobe. The two posterior cerebral arteries anastomoses with the internal carotid arteries via two posterior communicating arteries. The internal carotid arteries give rise to the middle cerebral arteries, which supply the lateral parts of the cerebral hemispheres and the internal capsule. The internal carotid arteries give rise to the anterior cerebral arteries, which are connected by the anterior communicating artery. The anterior cerebral arteries supply the medial and superior aspects of the cerebral hemispheres. The circle of Willis is formed by the basilar and two carotid arteries. They are linked by anterior and posterior communicating arteries. The circle of Willis is incomplete in up to 15% of normal subjects, and the circle of Willis supplies collateral blood supply in the presence of arterial occlusion. 3 out of 4 of the main arteries can be occluded gradually without producing cerebral ischemia. The normal intracranial blood volume is 100 to 130 mL. These are my references. The following is a diagram that shows the blood supply of the respective cerebral arteries and their regions. Thank you.